Bill Bowman from the Daily Item. Welcome back to our continuing conversations with candidates for political office here in Pennsylvania. Today we're joined by Dan Meuser, Republican candidate in the 9th District, the newly formed 9th District, which includes most of, if not all, of Montour County and a tiny portion of Northumberland County. So thanks for joining us, Dan. I know you're busy on the campaign trail.
Great to be here. Really appreciate it.
Let's sort of, I guess, start with where we just hit on with the district. Any challenges that come from the new district, just in terms of geography, where you have to get to, where you have to cover, what you have to learn, some new people you have to meet along the way?
Well, the 11th district suited us just fine for a number of months. Now, it was more of a narrow and longer district than the new 9th. But with the redistricting that took place and what's done is done, it was very arguably unconstitutional and how it went about. Certainly before there was gerrymandered districts, but in many cases what they did with these was different but not a lot better. But again, what's done is done, and it is the new 9th where we've been running since February. I suit the district very well, and I think it suits me. I do live in Luzerne County in Dallas Borough, which is towards the northern end, of course. So it requires us to probably be on the road a little bit more than if I was in the center of the district. But we make Pottsville our home. Pottsville is where our headquarters is. Pottsville is the geographic center of the district. And really, from a demographic standpoint, it makes a lot of sense. So it's where our campaign headquarters is. We do have a satellite office in Berks County, in Lebanon County, in Luzerne County. And we'll see, should we be successful on November 6th, we may follow that hub and spoke concept to make sure all counties are represented as well as possible.
In large part, it's sort of Lou Barletta's old district, the majority of it.
Absolutely.
What sort of help has he been in this campaign? I know you've been a supporter of his for Senate, and he's been a supporter of you for his former House seat.
Lou's a good friend. Known him for a long time. A lot of people have. When Lou got the call from the President of the United States to run for the U.S. Senate, urging him to run, one of Lou's first calls was to me and said, Dan, this is something I'm considering, so I want you to consider running for my seat. That was in June of last year. Towards the end of July, I got a call on a Friday. It happened to be the same day that, may he rest in peace, John McCain voted against repealing and replacing Obamacare. And Lou wasn't all that happy about it, to say the least. He called up and he said, you know what? I can do more good in the Senate, even with my strong position in the House of Representatives. And he said, I'm telling you right now what I just told Paul Ryan, I'm running for the U.S. Senate. So that was at the end of July. About a month later, 3 weeks later, he announced and I announced right after. And Lou did, in fact, give me his reasons. He said, I know you got a passion for public service. We need a conservative. We need somebody with business experience who's focused on results, not focused on going through the motions, and someone who's going to help advance the president's agenda. And I said, yeah, I think I fit all that criteria, and I'm ready to go.
Let's start with something that's in the news now, the situation in Saudi Arabia. How do you think the president is handling it? He's sort of giving the Saudis some time in some people's mind, but he's played it pretty hard from here.
Yeah, I think the president, like everybody, wants to get to the bottom of it. I think his language in that regard has been pretty direct, that this is a serious situation and we're going to do everything possible. And if we think there was any erroneous and inappropriate involvement, inappropriate on a murder is a very minimal way of putting it, of course, that we're going to deal with it. Frankly, I think the media is doing its best to somehow make this the president culpable here for a terrible act, perhaps allegedly at this point, by Saudi Arabia. So it's terrible. Somebody goes into particularly a journalist goes into an embassy and gets murdered. So it needs to be investigated. I mean, they're handling it right. The president. Not everybody likes how the president does things, but they like what he does for the most part, and the results are there. I think he toys with them, even on a serious issue like this a little bit. But I think in the end, he's for getting the information, understanding what happened, and penalizing and punishing those who carried this out.
Now you talk about him toying with people on certain issues. Isn't this the kind of issue that is serious enough that you shouldn't do that? You should approach it with some serious level of diplomacy.
I do, of course. Look, the president does things in his own way. Again, I'm more focused on the results and his policy plan than anything else. So I can understand how people would relate to that and feel that way. I do think in the end, though, he is country first, as he puts it, America first. I think he loves our country. I think he's the only thing he wants to do in his life is to lay out a plan, an agenda that's best for as many Americans as possible, and in the end, the world. That's how I feel. And his plan is one that I do get behind. I say in an unabashed way that I want to advance the President's America First agenda because as a business person, I like plans. I like seeing a plan, figuring out if this is the best route to go, and then doing our best to aggressively execute it with a sense of urgency. On the flip side, I don't think the federal Democrats, the national Democrats, and I do coin it that way because I do think national Democrats and their leadership are a far cry from our local Democrats. But there is no plan. Their plan is to largely obstruct what the president is trying to accomplish.
Mm-hmm. You've talked about it already. You're a strong supporter of the president across the board on the majority of issues. I'd like to touch a little bit on immigration. Your thoughts on the wall, on these separations that we've seen at the border, things like that. Now we have this caravan coming from South America. Sort of your support for the president in that regard. Well,
it's support of the president, but it's more so support of the people of the 9th District, and I think that's a microcosm of most people in our country. We need to have border security. We cannot have porous borders. We need an organized approach to people entering our country and things entering our country. I was with the sheriff of Berks County the other night, and I was asking him how things were going, and he brought up the level of heroin coming into the country, and he says it's coming from Mexico. I mean, he says that in no uncertain terms. Those are the people that we were arresting. Many of them are here illegally. And relatively came here relatively in the not too long ago, so we do need border security. I am for the quote unquote wall. There's nothing wrong with high fences and wide gates in our immigration policy. I am definitely against sanctuary cities. I don't think they make any sense at all, except for those who somehow run those cities and feel good about them. These are, by the way, are very significant contrasts with my opponent in this race. He's basically against everything Trump and I'll be more specific because he tends not to be. Even asked last night a question: name one issue that you don't agree with Nancy Pelosi. He couldn't name it. But I would say taxes, illegal immigration flow, how to handle it, the question of amnesty, Obamacare, repealing or replacing. I think it needs to be repealed and replaced. He thinks it's terrific. So, and I'm sorry not to go too digress here, but the legal immigration is one of the top issues that people bring up every day that I travel the district, and we need to have legislation that deals with it.
What do we do with those who are here, the Dreamers per se? Well,
the Dreamers, I don't see anything wrong with putting people in various categories. To answer your question, the Dreamers, the president offered a deal, right? A plan. Let's build a wall, and we will allow for the DACA to be here, children to be here with legal status, with actually some more progressive steps towards citizenship for those who fall in the DACA category. The Democrats, the Congressional Democrats, walked away from it. So there was no negotiation really whatsoever. So I think they should receive a certain type of treatment which allows them a path towards legalization and then an aggressive path towards citizenship. I don't believe that's the case for others that are here illegally. I do think we need to get them out of the shadows. I do think they need to register. They need to understand and be comfortable with a program which allows them to register and have a path towards citizenship. Those who work in the agricultural community should be part of the H-2A or a new bill called H-2C, led by Republicans, so as they could have a 3-year work visa as opposed to a 1-year work visa that exists today. That really doesn't work well for farmers. So I think they can largely be put into buckets, but those who fall into none of those buckets need to, again, register under what should be new illegal immigration legislation. And if they do not fall within any of the categories that warrant their legal status here, they need to leave the country under their own terms, not us involved in paying for it, so as they can get right with the law and gain legalization or citizenship under lawful terms. You know, I know that's a mouthful, but to me, it's not that complicated. You know, I think it can be done, and it should be done.
When you talk about the wall, are we talking a physical boundary, or are we talking, you know, some sort of with technology able to monitor certain areas of the border?
Again, you got to be reasonable in this and realistic. A wall where it makes sense and it works. There's no sense in a wall where perhaps one exists today, or if there's a different barrier. But certainly, walls send signals. Walls keep those out. So you know, we get hung up on the concept of a wall. It is a way of assuring, and they talk about the money, $12 billion. It's a way of assuring that, or helping anyway, keep those out, or making it very difficult to trespass illegally into our country.
I'd like to shift over into jobs for a little bit. You know, most people know a former state revenue secretary. What does that allow you? You know, what does that bring to the table in Washington for you?
Well, I understand budgets. I understand where the revenues come from. You know, certainly on a state level, but it's definitely relative to federal. I understand the process in legislation. Getting legislation passed. I was very active in a number of pieces of legislation. We actually did a comprehensive tax reform bill, which got very little press, but it did reduce taxes by about $1 billion. We did negotiate. I actually negotiated with the Speaker of the House, along with the governor, of course, approving it, the phase out of the capital stock and franchise tax. We led the effort to exempt family farms from inheritance tax, and then the following year we exempted small business from inheritance tax. So I saw how legislators view things, and why they act and why they don't act. I saw where special interest weighs in. I saw where next elections weigh in. I see what's wrong with that, but I see the whys behind it. It was invaluable. You know, I spent 25 years in the private sector. My 4 years in Harrisburg definitely gave me the experiences I think I need in order to be an effective member of Congress.
You talked about the how people are always running for re-election. You know, the Congress is every 2 years. I mean, it's almost feels like they're always running. Does that make the job more difficult, that you sort of are always looking ahead as opposed to looking at what is right in front of you?
Yeah, you know what? I don't know. I haven't been in it yet, but I think it makes sure that you stay near the people, and those who forget to do that probably have to run harder for re-election. So it requires a lot of work, a lot of dedication. You know, I'm at a point in my life where, you know, my 2 daughters are grown. One's in college, one's in the workforce. My boy, as we were talking, is still at Dallas High School. But my wife completely understands how important I believe this is, and she does as well. So you got to be ready to be there for the people. You got to live up to your commitments. You got to exceed expectations. You got to do your work in Washington, but you got to be an active member here. You know, there's a lot of work to do locally, right? I mean, you know, we dealing with these flood issues. There's all kinds of revitalization efforts throughout the 9th Congressional that I plan on attending those meetings and being a part of. You know, we've got an opioid crisis that's awful that we're gonna take a lead in helping corrective measures there. So you know, there's going to be a lot to do.
Yeah, just sort of go ahead.
Well, I was going to ask. I wanted to actually move on to healthcare because we hear an awful lot of criticism about the Affordable Care Act, but I don't necessarily hear many specifics about what the replacement part would be. There's always been the repeal and replace idea.
Yeah.
And even when we had Congressman Tom Marino in here just the other day, and he was talking about really the need to fix the Affordable Care Act and to make some specific changes. And try to be as specific as possible, if you can, please, sir.
Right.
Tell me what specifically you think in the coming year, 1920, that the Congress would seek to do to fix or amend or replace the current system.
Well, Obamacare, the Affordable Care Act, is a real problem for people in the 9th District and for Americans as a whole. If it wasn't, it wouldn't be a problem. But it is, and it was predictably going to be a problem. You cannot expand and create what was created when it was a significant increase in the Medicaid rolls and an enormously increased funding based upon a theory that by requiring all people to buy in, that was going to pay for it. It was like trying to disprove gravity. Wasn't going to work, and it's proven that to be the case. Costs have skyrocketed. I mean, certainly they were going up beforehand. The lack of effort in the early 2000s of not correcting where healthcare was going or health insurance was going is why Obamacare rolled in. So it's a very important issue. I mean, families of four in the 9th Congressional are paying $2,500 a month and having $5,000, $6,000, $7,000 deductibles, virtually not having insurance unless something catastrophic occurred. I do think the pre-existing conditions is something that should have been in healthcare and a requirement, a legal requirement for health insurance forever. I mean, it's unconscionable to think that you're going to lose your health insurance or it's going to go through the price is going to go through the roof because you get sick or because of a serious illness. So that is the one and likely only part that Republicans did vote for prior that didn't get passed, that many voted when they voted against Obamacare. Pre-existing conditions were in that bill, but they voted for a bill for pre-existing conditions afterwards. But to answer your question, what needs to be done is we need market-based choices. Competition is what leads to choices. It's what leads to making things better, and it leads to more competitive rates. I truly don't buy the idea that health insurance can't be purchased in the same manner that car insurance is currently purchased. Why not? We have initiatives and had them in the past before Obamacare, where some of this private insurance was really taking root. We dropped with Obamacare came through. We dropped the association organizations, the group buying insurance initiatives. Like for instance, the Farm Bureau had 12,000 members of an insurance co-op, basically. Which worked very well. They loved it. They would tell you now. They've sort of forgot about it. It's been a while. But they could call the Farm Bureau, get answers to questions, find out who your doctors were. The rates were good. Everything was good. Gone when Obamacare came through. So more specifically, we need to reduce the overstate lines, the inability to sell insurance over state lines. We do need to block grant to the states. There's simply no question about it. Block granting to the states for Medicaid will keep costs in line and, as importantly, maintain a higher level of quality care. So those are a couple of things. We have to reduce costs. There still is tort reform needs. There's malpractice issues that certainly the healthcare community will talk to you about. The idea that brand drugs are so much more preferred by prescribing doctors than generics. And, a doctor will tell you, well, the patient demands it and they see it on TV. That needs to be corrected. I think big pharma is a big problem in many arenas of healthcare and, frankly, our society. So we do need to lower costs with generic drugs. And of course, Medicare should be able to negotiate directly with the pharmaceutical companies.
When right now there's obviously, as you well know, there's a lawsuit going forward in Texas that would, if it's successful, declare the Affordable Care Act unconstitutional. A, do you support that lawsuit? And B, do you understand that lawsuit would then also make the pre-existing conditions part of it disappear as well? So I struggle to understand. You seem to be very much in favor of pre-existing conditions, and yet it seems like you probably would be supportive of the Obamacare being declared unconstitutional in this lawsuit.
Well, I don't want to throw the baby out with the bathwater, right? And I don't have too much of a problem either with the idea that you can keep children on or young adults on in your family up to the age of 25. You know, there are portions that make sense, that work for people, and can work into the affordability and allow competition to exist. But no, the lawsuit is about repealing yet replacing. And that is what.
Well, actually, the lawsuit's about declaring it unconstitutional.
Okay, all right, fair enough. But they're just not going to leave a vacuum. So, look, if there isn't a new plan, and that's something that Congress didn't do very well, granted, having a good new plan ready to go upon the repeal, I'm for having a good new plan in place. So if that means not being for what's occurring in Texas right now, then so be it. But I'm for assuring people that they'll have affordable quality care, but doing it better, not different, but better than Obamacare.
You mentioned Medicare just a moment ago, and I was watching an interview with Senator McConnell the other day, in which he said after the elections are over, one of the things that the Senate has to do is to, quote unquote, get serious about Social Security, Medicare, and Medicaid. Now, I don't know for sure what he meant by that, but that obviously is a huge part of the federal budget.
Yeah.
What's your feeling about those mandated costs, and if there are any adjustments that you would be in favor of?
Yeah, I don't know what Mitch McConnell is thinking or saying there. You know, these guys spent a lot of time in Washington, and some of them frankly need to go. It's not. I'm not saying that necessarily about Mitch McConnell, but perhaps it's not business as usual anymore. We actually got to get some things done. So I just think that we need to stop that sort of rhetoric and focus on delivering for what the people sent you there for.
So are there any changes you would be interested in exploring?
Absolutely not. Social Security is the one program of all the government entitlement programs that people pay into. They pay 6.2% in for sometimes 40 years. Their employer matches that 6.2%. That's 12.4% on a $60,000, $70,000, $50,000 salary over a 40-year period. That adds up to a lot of money. That's over $300,000 with reasonable growth, not to mention the fact that at that point, over the next 15 years, as they're drawing from it, that $300,000, not the accrued amount, is also growing through investments. So if there's one area that we should not even consider, it'd be unconscionable in my mind, is in cutting Social Security. I don't buy it. It adds up. There's no problem there, particularly when these people are now drawing $2,000 a month. So that covers them till their early 80s, if they're fortunate enough to live that long. So that whole thing, the math works in favor, and the right thing to do is to work in favor of keeping a promise of Social Security. You know, Medicare people have also paid into 2.25%, I believe, but it's not the same situation. Medicare is essential for people to know is going to be there. The idea that would be at risk is a terrible idea. Medicare is not free. Anyone who knows anybody on Medicare, there's some pretty sizable bills that come along with it. Am I for more efficiencies and some better initiatives to improve Medicare, sure. But the idea that those two programs should be at risk, they're off the table.
Okay. Brett?
As far as back to healthcare, am I hearing that you would not make any new program mandatory?
Yeah, I think the mandatory idea has been shown to be likely unconstitutional and has been repealed as of late.
Doesn't that add to the problem? People going around without insurance and getting sick? And then do the people that pay for insurance, do they pick up that tab?
Well, people, most of their insurance comes from their employers. If someone is, a young person that doesn't want to buy insurance, we are not in a country that is going to mandate somebody actually purchase a product or a service. It's required to drive a car and have insurance, but they choose to drive a car, so therefore they should buy insurance. No, I do not believe that our government should force someone to purchase insurance. Does it exacerbate the problem? I guess in certain ways, but I think that it was far more exasperated by the concept of forcing people and then penalizing them for not purchasing and counting on those funds, working that into the equation. I think that was ridiculous. And there's, there is overhead. Prior to Obamacare, most hospitals, not all, had about a 1.5% worked into their cost of doing business for emergency care that wasn't going to be reimbursed, that wasn't going to be paid. If so, people do receive, as we well know, somebody shows up at an emergency room, they, by law, have to be treated. So, the hospitals work that into their cost of doing business.
You mentioned briefly about maybe some changes in Washington with some leadership down there. And I haven't heard a quote from you about this, but I did read where you were concerned that maybe lobbyists have too much input in Washington. Was that an accurate report, and could you speak to that?
Sure, yeah, happily. Well, I saw firsthand in Harrisburg, and you read about and you see, just spend a half a day in Washington, you see the lobbyists flocking everywhere. Lobbyists play a role. There are lobbyists that provide information that can be very useful. My problem is with the revolving door. My problem is with a member of Congress or someone in a highly appointed cabinet level position or thereabouts upon leaving office, and it tends to be a year waiting period, but 12 months and a day after that waiting period, they're out there getting hired with a big contract for the same organizations that they were pretty much supporting while they were in office. That's the revolving door. That's the swamp. That I'm against. My opponent in this race, he, was Secretary of Agriculture almost a year to the day after leaving office, and it's documented how he was very supportive of Monsanto in particular, Monsanto Company, and a year and a day after he leaves office thereabouts, he gets hired by Monsanto under a very lucrative contract, and they're now one of his largest financial contributors in his campaign. That's inappropriate. People who make all kinds of money after leaving office. I like people who make their money before they get into office, frankly.
I think I want to switch gears to the budget and some deficit question, because I suspect you ran for Congress in 2010? 8, okay. So obviously this was before Trump and whatnot. I suspect at that point you were probably pretty supportive of keeping deficits down and not overspending and all that. We have right now a fairly booming economy. Unemployment's at a anytime recently low, and yet there's this huge growing deficit. And Republicans traditionally were well known for being against huge deficits. Some argue that give the current situation time, the deficit will come down. Are you concerned about the deficit situation right now?
Yeah, I was also concerned with it for the 8 years of Barack Obama, where we spent $9.5 trillion with, frankly, nothing to show for it, unless somebody can point out what's been done during that time frame. I was also concerned about it during W. Bush's time as president. I couldn't believe one year. Now, granted, they both can rationalize it. One had 9/11, a terrible situation that we had to come out of and entered into foreign wars. And certainly Barack Obama had dealt with the financial crisis. We were in free fall. But a lot of that money also was spent during President Bush's. Yes, we need to correct the overspending that takes place in our country, in our federal government. Our economy is doing extremely well. It's really not doing fairly well. I mean, the data is as good as it ever was, dating back to 1969, 1984. I mean, we got the highest consumer level of spending and wages and across demographics. So things are definitely humming along. But as far as our revenues right now are growing by 2.5% a year. That's what they grew when I was revenue secretary for the Commonwealth, which was pretty good. Prior to that, I was about 1.7. The problem is our spending every year, our national budget increases by 4%. So we really have a 1.5% problem to bring our spending to be balanced. If we want to start reducing the deficit, again, it just comes down to numbers. Or reducing the debt, we need to decrease our spending by 2%. We can find that. I'm very confident if Daily Item needed to, the number one goal or a top goal was to reduce your overhead by 2% this coming year, that wouldn't be too much of a problem. It's not at most companies, and it needs to be taken that seriously on a federal level.
And the difference is we'd actually do it.
Exactly. Of course you do.
Bilka.
Talk about Second Amendment. I know you're a strong supporter of the Second Amendment. I've read that you support arming teachers in schools. Can you talk a little bit about your support of the Second Amendment and that thought process?
I'm a big supporter of the Second Amendment, no question. The right to bear arms shall not be infringed. I mean, Pennsylvania's Constitution is very clear. The right to bear arms shall not be questioned. I am an NRA member. I think the NRA is about gun safety and gun responsibility and lawfulness. My father was a police officer. Growing up, I was taught gun safety from a very early age. I knew where he kept his guns, and if I went near him, I knew it, by all means, which I didn't. But I hunt. My son and I, we hunt. So, look, it's an important right for Americans. It's really just that simple. People want the right to be able to defend their home and their property. The idea of arming teachers is a very interesting subject. I do believe that we need to do more for school safety, a lot more. We need to get real serious about it. That's something that we should happen, and I'd like to be part of it. Now, as far as arming teachers goes, there are Tamaqua School District, for instance, in the district just recently has announced that they will allow teachers, certain teachers, ones that volunteer and qualify to bear arms, to carry a firearm. The vetting system is very extensive. Just yesterday was the first time I had an opportunity to talk with those on the board there, and they didn't even. It was 15 minutes of telling me about the level of qualifications and vetting and licenses and training and all that any such person in the school would have to go through. If we could go through all of that, and you got to leave it up to the individual school boards. I really don't see a problem with it. You know, my son's a junior in high school, and obviously in this office you look just beyond what's best for your family. Sometimes you don't consider what's best for yourself. But I do know that if someone came into a school and there could be retired military, retired police officers, someone who's very well trained in handling a firearm, I sure would like them to be in that school if a bad guy was coming in to do harm.
Would it be the federal government's job to sort of to fund that at a local level, or would that be a local responsibility? Because it sounds like you think it should be a local decision for whether or not to train the teachers appropriately. But should the federal government find a way to fund it to get some more safety resource officers in schools?
Perhaps. I mean, it could be some combinations of federal, state, local. You know, I mean, that would have to be looked at and worked into the budget, sure.
Okay. I only have one more thing. Property tax reform, which sounds like an odd topic to discuss with someone running for a federal office, but I read on your bio that when you go to talk to constituents, they talk about it's one of the more, I think the exact term was crushing effect on Pennsylvanians, is what I read. You know, as a federal official, what can you do to impact property taxes in Pennsylvania?
Well, you know, I brought out the idea that the methodology of collecting school property taxes was unconstitutional. I said it, and I believe it is. Now, there's a number of things, actually, that are unconstitutional that are laws and are carried out. But there's a supremacy clause of the U.S. Constitution that states, within it states many things, that the disproportionate confiscation of property for a far lesser fine is unconstitutional. It's without due process. Right now, there's a court case that the Supreme Court's going to rule on related to civil asset forfeitures. And right now, somebody could get stopped, and I'll just use, or stop reckless driving, and they can get their car confiscated. That seems like undue punishment. And anyway, right now it exists, and it's under county jurisdiction and state jurisdiction. So the Supreme Court is going to be taking that up soon. I do think that case could have effects on the methodology that's taking place today, where somebody can lose their home because they're past due in paying their property taxes. There's no due process that takes place. They just simply state, you're behind on your taxes, we're taking your home. Now, granted, that usually takes about 3 years, but I run into people, I'm not going to say every day, but at least once a week throughout the 9th District that are in fear of losing their homes. I was with a guy the other day. He was telling me how he's got to pay his property taxes. He's going to pay it partially, 72 years old, veteran, the whole thing. House is paid off. It's $800. He only has $500. He knows they're going to send him to collection, and he knows that $300 is going to turn into $500, but there's nothing he can do, or else he's afraid he's going to be thrown out. I mean, that's a problem, and one that we need to correct, and I think it should be corrected. I think the methodology of how we go about just raising taxes very capriciously, frankly, based upon the need for money, needs to be redone.
Mr. Meuser, I wanted to ask a question. You said earlier in this conversation we're going to take a lead in helping corrective measures there with regard to opioid addiction.
Yeah.
What's that lead look like? What are you going to do?
Well, you know, on our website we set up something called a resource center. So some counties have them, some don't, where people go on our website and they can view what's available to them from a hospitalization standpoint, education standpoint, right? You know, if I take this drug, what's going to happen to me? What are the addictive natures of it? We provided a summary of the problems that exist, what opioids can do if you overuse them, if you're inappropriately prescribed and you take too many, the addictive natures, and then when those prescriptions run out.
That type of information is available in a lot of resources.
Agreed. I'm not saying it's new, but we encapsulated it on ours. That's there's one area. What are we going to do specifically? A Senate bill just passed, that was passed in the House, which obviously I wasn't part of, but I was very favorable to, which does provide funding for recovery centers, does make requirements for smaller packets being sold by pharmaceutical companies, so doctors can prescribe 10 opioids rather than 60, which is currently being done. And there's of course, a few other provisions. but the drug awareness community feels it was the most sweeping and significant piece of legislation that's ever passed the Congress. So we need to provide people with availability for recovery, called what is called soft handoffs. When someone goes into a hospital because they are now addicted or have taken overdoses and maybe administered Narcan needs to be available too. That's also part of the Senate bill. They need to not be released back into the street. You can't force them to go to recovery, but it needs to be made available to them, and their family needs to know, because if not, there's a strong likelihood that's going to turn into a serious tragedy.
Does the idea of a warm handoff jeopardize at all by a repeal of the Affordable Care Act?
No, I don't think so. As a matter of, I'm not going to get into theory on where some of this epidemic came from, but no. If it did, that would be analyzed. Any bill I would look at. This is a life and death issue. This is not filling potholes, which of course are important, but this is truly a life and death issue. In Schuylkill County, and my guess is here in Northumberland County, it's not a lot different. We've had 62 deaths this year. Last year we had 50. We're already over here in October. It's a real bad situation. We're working with a couple of groups, one including Alive Today. On our website, we just did a video just discussing some of the how we're going to work together and raise awareness. I've been to a couple of high schools with this group, talking to young people, letting them know the dangers that exist. Oh, by the way, this bill, the Senate bill, also now has the post office having the funds to check all packages, so fentanyl doesn't come in from China and other places. Fentanyl kills. Fentanyl is highly addictive and is a killer. I mean, they're finding heroin laced with fentanyl. I mean, that's just a death potion. So it's a really serious issue. Should not be politicized. I don't think it will be. It's not being done for any purpose of gaining any votes. The whole idea here is that very often this starts from innocence, from being overprescribed, frankly, having access to these pills, getting addicted, and then moving to something cheaper like heroin. Like, the situation of the doctor in Mount Carmel, the level of prescriptions that were taking place there, it's outrageous. And it's also, I'll say, that I've stated that I won't take any money from Big Pharma until this problem is significantly corrected.
I think we're done. I appreciate you being here with us, and we'll have further conversations down the road.
For sure. Thank you.